So, yeah, Dr. Gordon Christensen, as David said, if you've been to a dental meeting in the last 30 years, you know who he is. He's a practicing prosthodontist in Provo, Utah. His educational credentials include his DDS from USC, MSD from Washington, Ph.D. from University of Denver. He's a diplomat of the American Board of Prosthodontics and a diplomat of the ICOI. But of course, we all know him because of his prolific teaching and writing as founder and CEO of Practical Clinical Courses and CEO of the Gordon J. Christensen Clinicians Report, which we used to know as the CRA newsletter. He and his wife, Dr. Rella Christensen, have done so much research since 1976. They've published their findings. And I'm really glad to have Gordon come back on the webcast today for this incredibly important topic: take your practice back, survive and thrive in the new dental economy. Gordon, this is just the message we need, and I so much appreciate you returning to share this with us.
How in the world do you take your practice back? It seems like I can't even remember practicing, although I did do a few patients last week, and I'm going to be doing a bunch of them this week. And as several have commented already, I must have a list of, I don't know, 50 people who are hammering on the doors. There will be an onslaught of people coming in demanding treatment. One old lady said, "I haven't been in. My teeth are going to rot out." She was about 80. I think she'll die before they rot out. But in the meantime, that's the kind of thing we're seeing. That's the group that puts the words in my mouth. That's the Clinicians Report Foundation. We're a nonprofit, as all of you know, and have been forever, and will continue to be. Over the last 43 years, we've survived on making educational materials and having you people fund us, because the government doesn't, and we certainly take nothing from manufacturers. There are a couple of websites you need to be aware of, and cliniciansreport.org is growing rapidly. We're in 100,000 practices worldwide in about 93 countries. The PCC Dental is our international study club, where I'm on the internet worldwide 5 minutes a week on the answer of the major question of the week. Now, where in the world are we right now? What are we taking back? What are we trying to resurrect? Are we going to go back to the same thing? And they're hard questions. That was January of 2020. Roger, you're the expert on this, but I follow it very, very closely. I picked a few representative organizations, but what's happened to all of that good news? It died. It died. And it died in an instant. It was just amazing. In February, I was still speaking out on the circuit, and I'm approaching my 4,000th presentation. As several of you said, I just can't seem to quit. And now we're into a whole different world. Here's out of the Kiplinger letter, which is kind of an average situation, recommending what is going to happen, suggesting what's going to happen. The bottom line of that image, though, is the yellow on the bottom. If we're not educating people about so many things, not just materials, devices, techniques, and concepts, but also safety in the office, that's going to be huge. And I fully expected that hygienists would be a little more irritable than the dentists as they come back, and we're seeing that. Although ours are coming back, I'm not upset there. Some of you were not with us when Dr. Rella Christensen, my wife, presented this 3-hour presentation, which would bring you up to date on infection control. Go to that pccdental.com if you missed that. And I guarantee you will get information you're not getting from the government, you're not getting from CDC, you're not getting from ADA, you're not getting from EPA. You will get real world stuff, and it will contradict much of what you're hearing. Sorry. And there's a 20% discount on anything you want from us. Just tell them that, well, what do we got? Discount May 20. You got it. Now, I'm going to go to the internet. It'll take us a little minute to jerry-rig this thing to get it going, because I want to use the premature report that we're bringing out right now, which is basically the essence of what we're talking about. I've gone to cliniciansreport.org, and I'm going to click it, and it'll throw something in for me, and then I'm going to click that. Now, do we have that on your image, or do I need to share it?
No, we do have it here.
Wonderful. That's fantastic. Now, I'm going to follow this report. Take your practice back, survive and thrive. Where do we get this information? We have 50 what we call mentors. They come at their own cost. They stay at their own cost, and they help me teach hundreds and hundreds of courses to thousands of dentists. So in this report, I'm sure we must have at least 500 years of clinical experience relative to how to get back. I'm going to go down this thing. You may get this free. I'm going to go back for a second if I can. No, I'll wait a minute before I do that. Let's go down to, Roger, you would be interested in this. Morningstar put this out. And what is it showing? Basically, it's showing we've had a lot of ups and downs, a lot of bull and bear markets, roughly 9 of them since 1926. And when dentists start thinking this is the end of the earth, you can refer them to things like this. No, it's not the end of the earth. We're going to recover. One of the most major things, though, is what do you do now? You need to have a plan. Is this large enough that you can read? If you've got some little dinky iPhone, it probably isn't, but if you're on a decent computer, you can probably see this. I'm not going to go down this list. I'm going to give you my ideas over and above what this group of dentists did. Dentists and basic scientists, we had both in there. You have to have a plan. You can't just go back, open the door, and decide it's going to all be the same. It ain't the same. It's going to be different, as Roger said, and I doubt if we'll ever see the kinds of things we saw before the Great Recession. You know, when that died, my gosh, we had lost 28% of laboratory work. And that was mainly all the elective things. We're going to suffer that for a while again now, because the elective things like what? Veneers, adult orthodontics, sleep appliances, occlusal splints, lots of things like that are going to have a tough time. You've got to have a plan. Where are you headed? And if you've been scanning this, which I hope you will, while I'm talking, I'm not going to go through this report. This report will be free to you. I'll show you how to get it in a few minutes. One of you mentioned the necessity to communicate. To whom are we communicating? Well, first of all, assure your family the odds are 99% that even if you have COVID, you're still going to not die. So confirm that to your family. We have good data on that. Make your family feel safe. In fact, I was in the grocery store Saturday. My wife, as she went back to graduate school many years, gave me that responsibility. But that was 25 years ago, and I'm still a grocery boy. Anyway, I went in to the grocery store, and I thought, I feel more dangerous here than in my practice. And I really felt that way. As I wandered the store, I'll bet 10% had a mask on. I think I was the only one that had gloves on. Confirm to the patients that you're coming back into a relatively safe environment. There's nothing going to be totally safe. As they drive their car in, they have a much greater chance of getting wiped out than they probably will in your office. Make them comfortable. The patients have got to be comfortable. And now you've got the hygienists. Good luck. The hygienists are going to be harder. And I understand that. There are 3 things in the office that create aerosols to an unbelievable degree. You're not the only one. The hygienist with that ridiculous ultrasonic scaling. I have one hygienist that just about drowns the patient. I have to tell her, turn the water down, turn the water down. The aerosol is enormous. And some of you forget to put the lid on your stupid ultrasonic cleaner. I wish you would go to a dishwasher, and there are Melee or many of them out there that will eliminate that hazard. And what's the third one? What's the third one? You and the aerosol you create with the aerotor. And David, you were noting the aerosol procedures, that you're going to differentiate them from the non-aerosol procedures, and that is going to be mandatory. We are studying right now very heavily air filtration devices, and I'm not going to give you any detail because I'm depressed. To date, we have nothing we have found that's doing a good job, period. Within 6 weeks, we will have information from Clinicians Report Foundation, our group, our nonprofit group, that will be observing many. There are about 20. We're not going to do that many. Some of them are really rinky-dink, but we will have information for you relative to the ones that look best. To date, we found nothing that totally cleans it and almost nothing that takes away COVID. So be cautious. Don't go out and buy some piece of junk. We've already seen a lot of dentists doing that. Be careful. We'll get that information to you shortly. So who did we say then? Let's get that information to your family. Get them calmed down. Get that information to your patients and your staff. That's not a prioritized list, but it's a very important one. The communication is highly essential. Now, what about an operating budget? It's not going to be the same budget that you have been on all your career. It's going to be very different. We're just evaluating how much it's going to cost to do the normal infection control. One butt seat is coming out about $20. In other words, they just settle down in your chair. You already killed $20 of overhead, give or take. And if I really got into every aspect of that, it would be far more than $20. So just plan on that. That's another thing. I strongly suggest that you and I get together and we form some kind of a coalition to go to third parties, say, look, you boys and girls, the hospitals charge for infection control. We've got heavy duty infection control. In my heyday of practice, I was seeing somewhere between 20 and 70 patients a day. You put $20 on that and you see there's a very significant chunk of money. You add that up over a year and it's a pile of money. It's just supposed to be fading into the cost of the crown or whatever. We got to get turned on there. Establish a new operating budget, one that will be markedly different from what you're accustomed to at the present time. And you can see what I'm listing up and down the line, or my team did. What are you doing during this time? I would strongly suggest, if you're not back into practice yet, that you use this time. It's a forced vacation, a forced vacation. I've been doing, as probably several of you have who are on the team putting these webinars together, I've done what? 30 over the last just few weeks. So there's so many of these, and they're all on different subjects. Listen to some of these from the various people that now don't have the ability to go into dental society meetings. So what are they doing? Webinars, webinars, webinars. I'm to the point where I'm kind of tired of talking to the wall. I know you're out there. I know there are a bunch of you, but I can't see you. You could be in your pajamas or nude for all I know. Well, figure out what to do in this downtime. I suggest getting continuing education. I sincerely do. In fact, that's what I've done, tried to upgrade myself. What to do when you're back in practice? Become consumer driven. Know your patients. Know who's affluent. Know who's poverty stricken. Know who's got 6 kids. Know who's divorced, a single mother. Know these things about your patients. Then when you talk to them, when you do a diagnostic appointment, you're able to aim at their family, at their potential ability to pay, to their dental education. And if you don't do that, everybody's not the same. I guarantee you, in our overall orientation in my practice, over the many years I've practiced, we have what we call an auxiliary-oriented diagnostic appointment. They spend about 40 minutes with the patient collecting all manner of diagnostic activities that you could imagine and educating. So when I come in, they already have a good idea what's going on in there. Obviously, the auxiliary cannot do the diagnostic activity. They can certainly collect the data. And when they do so, I meet with that person before I go into that operatory, and we will discuss what they've found out about the patient. Do they have a benefit plan? Are they a kind of a wimp? Have they had legal challenges? As a prosthodontist, that's about half of my patients that have had some problem and they're mad at some dentist. I want to know all that stuff before I wander in there. Know your patients. Become, as I've got on that blue phrase, become consumer driven. Give them what they want. Some just want patches. I'll bet you're going to have a lot of patches right as soon as you go back. You're going to have a lot of composites. You're going to have people who will say, can't you just do a filling on that and not a crown? You're not going to do a mouthful of implants. It's going to be bread and butter, more and more and more bread and butter. Well, what's this low budget front end? Many of you have mutual funds, and you know you go into some mutual funds and you got to pay the front end load. You go into others and you just leap right in. Now, how do I relate that to dentistry? Don't charge them an enormous fee for the initial comprehensive exam now that they're coming back from sitting in their bedroom for weeks and weeks and weeks. As is stated in that second bullet, be fair. I always use the statement, I won't do to any one of my patients something that I would not do to whom? Myself. Look in there and think, if I were this patient, and if I had their apparent financial possibilities and their apparent lack of or acceptable dental education, what would I do? And go right there. You can upgrade it just a little bit. But there are so many things that you and I need to look at as we're aiming back into this unknown time. There are many, many, many so-called ripple effects. What the heck is that? Probably one of the most important ones is, are you safe? When I come back into your office, can I expect that you're doing everything that can possibly be done that would protect me and therefore my family and therefore a few of you, my life? Are you doing everything? I think that's one of the most important things we must do at this point. And I don't know what your states, all 50 of them, are doing, but I know what our state, Utah, is doing. We were capable of coming back with non-emergency patients May 1, and most have done that. I would suggest that you create a form, and we have one available for you. I'll show you how to get these free of charge in a few minutes. We have a form that the patient must answer the questions on before we'll even let them in the building, not the office, in the building. On the outside of the building at this point are signs that say, to protect you and our staff and your family, may we please take your temperature, and may we please put a mask and gloves on you as we bring you into the office, and we will take you directly to a room that has been prepared just for you, and it will have, we won't tell them this, but it will have a barrier over it, over the chair, and we will use every precaution as we go about that. Now, as you see this form, I'm not going to show it here, but you can get it free of charge if you want it, that they will have their treatment completed. And when that happens, again, we'll clean them up as much as we can. We put a mask back on them. We put gloves on them. This is what we're doing. The front desk people go to the outside of the building and make sure they filled the form out correctly. And it's the standard questions you would expect. Have they been out of the country, blah, blah, blah. You know, all of the things. And if they pass that and they have no temperature, do we know they don't have the virus? No, we don't know, but at least we have a reasonable idea they don't have the virus. That second point, ramp up your marketing efforts. Yes, 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 yes. That mainly to me means increase and refine your education. Know your patient. Look into their life as much as you know about it, and attempt to aim your thoughts and your suggestions on them individually. Internal marketing is enormously important at this particular time. They want to know that you know them. Well, there's a lot of external marketing that can be done, ethical and unethical. I would suggest with the ethical marketing in your church, your synagogue, your Lions Club, your Kiwanis Club, there are all kinds of things where you can essentially say to those people who are your friends, your associates, your neighbors, that yes, we're back and we're using every precaution to protect our patients. We dentists are well known in the medical arena to have better outpatient infection control. I'm sorry, and I don't particularly want to be quoted, than some of our medical colleagues. I know you've been into some where you wondered, what kind of infection control is this? With no gloves on, with no mask on. So we do have a reputation in the medical area as being very up to date, but we also have a bad reputation. What's that? All the droplets, all the aerosols. No question at all. Well, these are the kinds of things that I suggest that you and I must be doing as we go back into the practice. There are so many things that can be done. Now, what about this PPE? We're getting that question routinely. The last little webinar that I had with Glidewell was on infection control, and we are remiss there. The typical dentist in America, I don't know the exact percentage, but it's well over 90%, wears scrubs. That's the underwear of a general surgeon, whether you know it or not. It has nothing to do with infection control. And CDC stresses completely that you need to cover all the skin as much as you can. That's going to be one of the most major changes you're facing as you go into the office, because you can hardly get a gown that is high neck and is long sleeves. I'm married to Dr. Rella Christensen and have been forever, and she's an infection control guru. I've worn high neck, long sleeve, which I hate, I'll be candid, for many, many years. And in fact, a lot of the long sleeved ones do not have a puckered up cuff on the wrist, and therefore you can't even put the glove up over. It's wide open, so the bugs can crawl in there, fornicate, and have more bugs, and you're in even a worse shape. Bottom line is, look seriously at what is different now with all this infection control stuff that you were not doing before. I can say very candidly that we dentists have been remiss with our attire. We've been remiss with where we cleaned it or threw it away, or in whatever orientation you're using. We've also been remiss in many of the devices and materials we're using. I'm going to be straightforward right now. We're being criticized at this particular point by some of the companies because we're suggesting things that they have not been doing. You may not know, but clear back in the Reagan area, governmental observation of and research on infection control products was discontinued as a budget cut. So what? So since that time, that's a long time ago, that's 80s. Since that time, the companies are the ones doing the research on their products. That's like Chevy saying, oh, we tested our car and it was the best one out there. It's like letting the wolf present in the chicken house. Have you got that little analogy? I'm an old farm boy. There is no question I'll say it very strongly and candidly, that many of the products you're using don't work. Have you got that strong statement? We're being criticized right now because we're basically not naming companies, but we're certainly stating that some of these companies that are promoted by the major organizations in infection control have had their research done, unfortunately, by the company itself. Often not in the presence of a bioburden. What's a bioburden? Blood, saliva, mucus, food debris. You can put these viruses in a situation that does not have that present, which many of these companies have done, and kill them with bad breath. I'm not kidding. It's time to get irritable about the products we're using. It's time to get the government to wake up and get evaluating these on a non-biased level. Our group is non-biased and has always been from day one. And when we find something diametrically opposed to what the company is advertising, you want to know it. And right now, a lot of you are using products that literally do not work. Well, anyway, I know I sound like I'm on a religious soapbox, but I'm pretty irritated. I think much of this infection control problem that we're experiencing right now could have been overcome had the government taken their responsibility and actually observed and evaluated and tested in the presence of bioburden all of these products that are now coming out. You want to put Clorox all over everything? Your office smells like a dang nursing home. It smells like stale cat urine. No, I don't want to use that. We proved years ago that ethyl alcohol was about the only thing, and other alcohols, that will deactivate a virus. Nobody listened. Now what are they doing? Oh, you can't get any more alcohol. You're right. You're right. Finally, that research is coming up. Anyway, the bottom line there, have a plan to retire your accumulated debt from the crisis and then start a reserve fund, as Roger said. I have, as many of you do, I have articles here and there and everywhere every month. One of them coming out very shortly is in Dental Economics, and it says clearly, get your fanny geared up to the point where you have a few months of reserve in your family, in your practice, in a food supply. Many of the dentists that I know very well were basically living from hand to mouth. In other words, they've done a day of practice and the next day that's gone. We got to get ready for the next pandemonium. And that's what I call it, rather than, it is pandemonium, and it could be a family crisis. It could be any kind of a thing. Well, recognize the paradigm shifts. What are they? That's an interesting statement. The Swiss lost the watch market when they refused to convert their operation from mechanical to digital. Unbelievable. We've got to change. A couple of you guys in the preface to this little seance said that very clearly. This is not going to be the same practice in the future. Not at all. It may raise the fees for dentists because obviously when we're going with multiple patients, I've always practiced out of at least 6 operatories, 6 or 7, and you're leaping from chair to chair to chair. We're not going to be able to do that as much anymore. I don't think patients will tolerate it. We've said some important points on that paradigm shift piece. Involve your team. Get them involved as much as you can. The hygienists are very smart people. In many situations, they smarter than the dentist. So get that group working. Don't put down your dental assistants. Several of our dental assistants have been with us for 30 years. My goodness, they know this well, probably better than most dentists. Now, I'm going to go back. I'm going to go back and turn this off, and we'll go back to the bot. Are you seeing this thing that says clinician's report now on the top? Are you okay?
Yes,
Yes, we are.
Christensen,
Oh, you
we
are. Okay.
We are.
Now, go to cliniciansreport.org, and here's how you get some of this freebie stuff. Go down to the bottom of this page. That page will come up. Go down to the bottom of it. Now I'm going to blow this up if I can. No, I can't blow it up on here. Where it says complementary information, you can pull up the COVID-19 special report that has now gone to, I don't even know how many. I'm guessing we've got that to at least 300,000 dentists worldwide. And that is state of the art, free to you, COVID-19. We also have the Q&A period with Dr. Rella Christensen, and she hits it in the gut. When something's not working, she says it. Sample letters to patients. Okay, we've got a lot of COVID stuff here. Sample health screening letters. Complementary information then, and that is on cliniciansreport.org. It's one big long word. I gave it to you previously. Now let's go back to finishing up right here, and I'll summarize for you. Here we go, rapidly. What have we talked about here now? See if I get my computer to work. There we go. Oh, by the way, if you want sample copies of the CR report, scan that thing. I'll leave it up a second, and you'll get some sample copies if you don't have it. And you can get a buying guide. That we're the only group that actually tests the products, as they listed a bunch of products. What did I say? Get optimistic. We're going to pull out of this. We will pull out of this. Conserve your cash, as Roger said. Don't overspend. And I don't mean just in the practice. I mean in your family. Conserve that cash. When you get a new product, it better darn well be these 4 words or phrases that we use routinely when we evaluate products. Is it faster, easier, better, and is it a lower cost? If it misses any one of those, forget it. Kiss it off. Have a plan. If you're not sitting down with your staff and getting a plan to get this thing going, it ain't going to work. If you bumble in there as you were before this pandemic and expect everything to be normal, you're sadly mistaken. It's not going to be that way. Now, communicate to the groups that we talked about, especially that staff. Get that staff geared up to support you. I heard the dentist at one of the webinars we did last week. We're doing interactive webinars where the participants participate in the verbal aspect of it. And I had a guy who, one of you mentioned in the pre-session here, how his hygienists were complaining and they wanted this and that other and the other thing that they're going to demand before they come back. Well, you heard the message on that from our attorney. Get the staff strongly supportive of you. Establish an operating budget and hang on it. And it should be one that's very doable, even at a low level. What to do while the patients are coming back? We've got an all-access pass to all of our videos, 70 major videos, highly professionally done. If you go to the website, pccdental.com, page 3, you'll get the whole thing. Become consumer-driven. Give them what they want. Know them well. Know exactly what they want. And go for it. And consider a low-budget front end. Don't jump in on a half a dozen crowns. Jump in on mandatory things and subsequently tell them about elective things. And conserve. Help them to conserve. And then this ripple effect of infection control is going to haunt us from this time on. It really is. It is going to haunt us. And, there's something I got coming up shortly, Saturday, May 16th, virtual. 50 clinical tips directly geared to those three phrases: faster, lower cost, higher quality, as we go back into this new type of practice.